Hi, this is a video on clarifying some confusions about the practice of psychology and psychologists. As an educator, as a practitioner, and as an advocate of mental health and wellness, I've received several messages about how some of us are confused about the exact work of psychologists. There's a lack of clarity between our roles and between our functions and our licensing. So I've put together some information that I hope will provide some clarity. I would want to begin with clarifying what psychology as a field studies. It's the most general definition is that it's a scientific study of behavior and mental processes. So you see, it's scientific, which means it's not based on any assumption or random events or somebody waking up one fine morning saying, this is how human beings function. It's based on very robust scientific principles of explaining, understanding, assessing, predicting, and controlling behavior and mental processes, So we've got robust scientific methodologies. What do we study? We study behavior and mental processes. So when I say behavior is anything that is overt, outside, visible to all of us. For example, right now when you're clicking on this video, it's an overt behavior. When you're smiling, it's an behavior. When you go shopping or when you push someone, when you do something that is outsidely visible, it's behavior, and we have scientific ways to study behavior. We also study mental processes. Mental processes are activities that happen in my brain, which I cannot see, which you cannot see. For example, right now when you're understanding what I'm saying, when you're thinking about it, when you're reasoning it, when you're making decisions, problem solving, or the use of language for that matter, are all mental processes. I've put ABC of psychology. If you see, A stands for affect or emotions or feelings. B stands for behavior, and C stands for cognitions, that is your thoughts and your beliefs. So, and there is a very beautiful dynamic interaction between my A, B and C. How I think can influence the way I feel, which can influence the way I behave, and feedback on my behavior can further influence my emotions and my thoughts, and it's a dynamic, constantly evolving interaction between these three. Many of us are aware that we have a very robust history of experimenters and theorists who have scientifically proposed the various ways of understanding this ABC of humans and animal beings. But on the field, what do psychologists really do? How do we look like? What do you see us doing? What do we work on? As such, we perform multiple roles, so it's really difficult to encapsulate our work in very watertight profiles or roles, but to give you a broad understanding, some of us engage in full-time academics and research, and we continue to examine human behaviors and mental processes under diverse perspectives or diverse frameworks or under different lenses. When we do this kind of work, it leads us to develop certain new theories of understanding and explaining human behaviors and mental processes. And we also come up with newer ways to help them cope with their problems or treat certain concerns that they may be having. So that is really the foundation of our work becoming better on a daily basis. Some of us also engage in practice full-time, where we engage in dealing with mental illnesses, health and wellnesses. Of course, there is an overlap again in these three, but to explain the clarity in the terminologies, mental illness is when the field looks at assessment, diagnosis, treatment and rehabilitation of individuals who have been diagnosed with some sort of an abnormality. For example, individuals being diagnosed with, let's say, autism or with schizophrenia or with psychotic disorders or personality disorders. They are assessed under a specific diagnostic criteria, and we don't call them abnormal people. The ideally technical term is that these are individuals diagnosed with some abnormality. Some of us also work in the area of mental health. So mental health is an area where there is a specific need or a concern or a problem that is arising in the life of our human beings, and it's getting disturbed and it's interrupting my daily life. It is interfering with my functioning. It's troubling me. It's not allowing me to perform at my best. And all the domains of my life don't look very balanced. For example, I may be great at work, but my relationships may be suffering. And I may be having trouble asserting myself. I may be having trouble getting onto some personal work in my life. So counseling psychologists, psychotherapists, coaches, mentors are people who really enter into this field of mental health. Mental wellness, on the other hand, is, there is no specific concern or a problem. Life is not halted and life is also kind of balanced. But then humans also ask this question, what next? How can I flourish? What is the existing pattern that I have which can be made better? So there's no problem, but it answers the question of what next? How can I become better? So fields of positive psychology, channels of counseling, therapy, coaching and mentoring also help in that. Now let's jump to a couple of clarifications. Who is a psychiatrist? How is it different from a psychologist? Who is a counseling psychologist? Do they figure out problems for us? Can anyone be a counseling psychologist? What's the difference between a counseling psychologist and a coach? Do they give us any advice? Is it allowed for them to give me an advice? How do I approach for which problem? Who do I approach for which problem? Let me look at who a psychiatrist is first for you. A psychiatrist, typically, you must understand, is a doctor who has a medical degree and a specialization under the biological model to diagnose and treat psychological disorders. So they follow a medical model of cure where the person who approaches them is called as a patient. So they will look at, for example, you've been having depressive episodes and you approach them and they scientifically diagnose that biologically your neurotransmitters are not functioning as well as they should be, and thereby you're experiencing episodes of depression. So what they'd offer as treatment methods that they have are medications and medical approaches where probably they'll put you on drugs for a little time. Many of them also suggest that we parallelly go into psychological work or with a psychologist, clinical psychologist, or with a counseling psychologist. They also offer psychotherapy, suggest psychotherapy. So psychiatrists are really using your medical model of cure. Who is a psychologist then in that case? So a psychologist, if you see, has no medical training as such, but we are well learned into the aspects of human behavior, human mental processes. So we can have a master's degree and an MPhil degree and a PhD degree in psychology. We go through intense academic training. We also go through intense practice training where we get supervision, we do internship, we do practical examinations, etc. We work also in various settings, for example, schools and organizations and hospitals and clinics and judicial systems. And we also have different specializations, like you can work as a counseling psychologist, we can work as a clinical psychologist, we can work as an organizational psychologist. And not every psychologist can be a counseling psychologist. That's something I wanted to clear. There is a licensing procedure where you can be a professional counseling psychologist and a licensed marriage and family therapist. So you see the basic differences over here on the slide that I put up, that psychiatry is a medical treatment, he's a medical doctor, while psychologist is the study of a topic, which is an extensive training in research and practice. But both are experts in mental health and both can conduct psychotherapy. Now, I told you that we have different specializations under psychology. So I could be working as a clinical psychologist, a counseling psychologist. I could work under human development exploration. I can explore behavior and mental processes in educational field. I can explore behavior and mental processes under cognitive psychology. I can see how humans function as employees and employers in an organizational setup. I can see how humans behave as in a social circuit in social psychology. I can see the evolutionary basis of human behavior and mental processes. I can see how my biology is related to my behavior and my mental processes under psychobiology. I can look at flourishing humans under positive psychology. I can look at cross-cultural growth and comparisons under cross-cultural psychology. Let me tell you who is a clinical psychologist. A clinical psychologist, is focused on mental disorders and illnesses. So they will diagnose, they will help you identify the causes and the treatment of these disorders with the help of a psychiatrist or with the help of psychotherapy, depending on the concern that we have. So they really get in-depth understanding into abnormal psychology and into health psychology. They work in line with a psychiatrist who would be giving them, medical treatment. So if you see, I've depicted in the picture, both work hand in hand with each other. Counseling psychologists, on the other hand, are individuals which is an applied psychology field, really. We aim to help and support people with their personal problems, with their adjustment issues, with their career choices. It's short term by nature, and no, we don't give advice, we don't figure out problems for you. But what we do really is, if you see in the picture, we provide a safe and a comfortable space of genuine care, of genuine concern, of acceptance, of empathy. A safe space where you can explore what discomforts you. You can explore whatever you want to in your life, in your personality, without the fear of being judged or ridiculed. We stay with you to help you find the resources to cope with your stress. We stay with you till you figure it out on your own. We don't want you to get dependent on anything. We would like you to function as independent, fully adaptive, functioning individuals, and it is perfectly okay to ask for help, because we are here for you to help. It's like having a mind outside your mind who can engage in conversation with you in a very rational manner, in a way that it is productive, without the fear of judgment or without the fear of being ridiculed. We have to get licensed to work as a counseling psychologist, but unfortunately in India we are lacking yet a licensing body to practice as a counseling psychologist. We have the RCI, which is the Rehabilitation Council of India, which licenses clinical psychologists and special educators and rehabilitation psychologists. But for counseling, currently the pattern that we are using is a master's in counseling psychology with internship and with supervision and with other additional work courses that you can take up to improvise yourself. One word of caution, a lot of people are using the word counselor, but we would prefer that we use the word counseling psychologist, because right now there are a lot of profiles that talk about counseling to you about a particular course or about a particular program or an international program. So they are called counselors. We call ourselves counseling psychologists. What is the difference between a counseling psychologist and a psychotherapist in that case? So psychotherapy, is a long-term issue, while counseling psychologists will help you deal with day-to-day adjustment issues and will be much more short-term. Psychotherapy will be long-term and we explore deeper issues. For example, if I have a deep-rooted commitment fear, or if I'm unable to say no to anyone and I feel miserable about it, and I'm having a lot of disturbance in my life, or I feel like I'm making unhealthy, repeated choices in my relationship partners, which could probably be because of my primary attachment style with my parental figures, I may need to go deep down into my awareness, into my childhood memories, and I may need to see what is coming from where. So the word that I'm offering here is personality restructuring, right? We look at some deeper issues, we uncover childhood issues, we see patterns, and then we bring to the picture, we bring to our awareness, what can I do about it? It's not a blame game at all. It is to see what happened back then, because of which I am who I am today, and can I make certain re-decisions to be able to live life in a healthier way, in a more productive way. A very recent contemporary world of work that started off is coaching. The International Coach Federation defines coaching as partnering with your clients in a thought-provoking and creative process that inspires them to maximize their personal and professional potential, which today is very important in today's complex environment. Coaches really honor the client as an expert in his or her own life, and they believe that each client is creative and resourceful and a very whole person. They dramatically help their clients improve their outlook on work and life, and improving their leadership and unlocking their potential. So they work on identify the potential, enhance them, help them grow. It's more action oriented. They challenge their clients, they focus on improving the outlook towards life, your leadership skills, and etc. So it's more about growth than what you already are doing. There is a large difference between a counseling psychologist and a coach. See, for example, counseling psychologists would have studied other aspects of human life, like human development and social psychology, but coaches are not necessarily having a background in psychology. I mean, you can do a graduation course and get into a coaching certification program and be a coach. So you may be limited in understanding as a coach if things that are happening are because of depression or adult ADHD or any other mental disorder which a counseling psychologist may be able to tap. Counseling psychology is more coping oriented, like I said, where we often create a safe and supportive space for you to explore who you are and what you want in your life and how you want to solve your problems. But a life coach is trained to help you see where you are and how you can go forward and where you already are. So a counseling psychologist may not challenge you enough, but a coach may challenge you enough to do better and move out of your comfort zone to be able to achieve greater heights. Counseling psychologists also don't offer advice. Even in the most directive psychotherapies, we don't be very direct in our advice. But coaches can make recommendations and brainstorm solutions with you and strategies. Also, counseling psychologists can focus on your past and present and future, but coaches will typically focus only on your present and the future. Lastly, counseling psychologists and therapists have a supervisor overseeing their work. We have bodies that we have to be responsible to, and we maintain strict ethical guidelines. We are bound by the American Counseling Association and our institutions to adhere to ethical boundaries of confidentiality and privacy. Coaches, once licensed, they are not supervised very often, and they're also not bound by any ethical regulation. So who do you choose for what really depends on your personal preference. If you want to focus on what you're dealing with right now and you don't want to get too personal, you just want to kind of improvise in your life or career, then coaching is a great idea. But if you're curious about breaking patterns of thinking and acting that have kind of been plaguing your life for some time, you want to understand what this is about, you want to raise your self-esteem, and you want to figure out what you want in life, counseling psychology may be a very good choice for you. In fact, a lot of counseling psychologists are now integrating life coaching approaches also with counseling. And they call it psychological coaching, So they kind of bring in a blend of both the work and offer to you. If you see, I've put up also a comparison chart for you to just kind of pause and see what is the major differences that we have spoken about, so that you can get a clarity on who do you want to talk to about whichever concern that you have. Should you have any further specific queries or you need individual counseling, you can feel free to reach out to me on my Instagram handle, or you can even drop me a personal email on my email address suggested on the slide, and I'll be happy to help you out.